Well, here's something that could impact the healthcare shortages we just heard about. Health officials in the U.S. have slashed the recommended COVID isolation times in half, from 10 days to 5. The CDC's new guidelines apply to asymptomatic people who have tested positive, as well as those who have been in close contact with a positive case. CBC's Katie Nicholson is following this story from Washington. Good morning, Katie. What is the rationale behind this decision?
So the Centers for Disease Control essentially looked at research on transmission and at which point in your infection people tend to be most infectious, which according to the studies, it's about 1 to 2 days before any symptoms appear and 2 to 3 days after. So it was based on that they developed this new guidance, essentially cutting the recommended isolation time in half. So for someone who's asymptomatic, your isolation would now go from 10 days to 5, followed by 5 days of wearing a mask whenever you're around others. Now, airlines, of course, were pushing for this last week ahead of all those cancellations, warning that the 10-day isolation periods and quarantines were just going to impact the industry. And indeed, we certainly saw that over the last couple of days. And there were concerns that the current isolation rules would impact healthcare and other critical industries going forward, much like we're hearing in Canada. So Dr. Anthony Fauci last night praised this change.
I think that was a very prudent and good choice on the part of the CDC, which we spent a considerable amount of time discussing, namely getting people back in half the time than they would have been out so that they can get back to the workplace doing things that are important to keep society running smoothly.
So, Jennifer, some critics are concerned that the CDC didn't recommend that people take rapid tests before they end their 5-day isolation period. And there are worries that when people start that 5-day masking period after their 5-day isolation period, that they won't be wearing proper masks. They want to see people wearing those high-grade, proper-fitting masks.
Katie, amidst all of this, we know there's another holiday weekend just around the corner. How much of an impact is New Year's Eve expected to have on the Omicron surge in the U.S.?
Well, COVID goes where the people are, and when people gather and mingle, it likes to spread. And we found out that just a little while ago, the CDC now saying that the Omicron variant represents about 58.6% of total COVID-19 cases in the United States as of Christmas Day. And there's been a lot of testing since then, too. And if you look at recent numbers from Johns Hopkins University, the number of new daily cases is up 47% from last week. This is all during the holiday season. And the U.S. is averaging nearly 200,000 new cases a day. That's the highest number since last January. And the Johns Hopkins numbers also show a 17% increase in the number of Americans dying from COVID from the previous week. So hospitals are signaling, too, that it is younger patients who are being admitted as this Omicron wave is just spreading like wildfire through the U.S. right now.
Katie, thank you for this. CBC's Katie Nicholson with The View from Washington.